The trends in nursing are numerous. These trends include higher education for nurses, changes in workspace for nurses so they have more support and residency programs for new nurses. These are more positive trends. Unfortunately, not all the nursing trends that we're seeing are as positive. For example, the projected shortage of nursing in conjunction with the difficulty of getting into nursing programs is a more negative trend that we are witnessing. However, the trend that I envision impacting my career the most is the use of evidence-based practice. Evidence-based practice is the conscientious and judicious use of current best evidence in conjunction with clinical expertise and patient values to guide healthcare decisions. Nursing has deeply rooted traditions in patient-centered research and using evidence in practice. Florence Nightingale's practice around infection control is an old example. Despite this tradition of using research in practice, it's not uncommon for nursing care to become stagnant. At the beginning of one's career, you may learn one way to implement care, and despite evidence showing that another way has better outcomes, it can be a challenge to switch what you originally learned and what you've come to know to a different way. As well as that, we are working alongside other medical providers who also have their own ways of doing things and who may come from a different perspective than we do as nurses. I think that for a very long time, we've lived in a paternalistic world where medicine has been very paternalistic, and this has created a very static approach to healthcare, where it's taken time for us to accept changes and evidence that would evolve our care. Some examples of evidence-based practices that have not been easy to change to, but do have good outcomes, are the use of Foley catheters. So Foley catheters are often used when patients need to have surgery and they're under anesthesia, and they're even used for women at times when they have an epidural and they're in labor for a long time. However, there is a lot of evidence that shows the longer that a patient has a Foley catheter, the higher likelihood of getting a hospital-acquired infection. However, busy nurses may prefer to use a Foley catheter as opposed to going to that patient's room whenever they need to use the bathroom, or using a bedpan, or using a straight cath, because it requires a little more time with that person and not as much time with all your other patients. Another example is delayed cord clamping in childbirth. So it's been custom that when a baby is born, baby will be cut from the umbilical cord right away, despite the placenta still being in mom's uterus, and baby would be whisked away and looked at. However, evidence shows that leaving the baby on the cord for longer has amazing benefits for both mom and baby. It's easy to understand, however, why it would be easier to just cut that cord so that baby can be looked at and make sure baby is adjusting to breathing well, and while the provider who's working with mom is making sure mom is not bleeding uncontrollably and that her health is okay. So these changes are not easy despite the evidence that strongly supports them. The reason I highlight the trend of using evidence-based care is because I highly believe in it, and I highly believe that these outcomes outweigh the inconveniences that we may experience as nurses. Many of the studies used to develop evidence-based practice recommendations are based on nursing research. Nurses asked questions about practice and, using the scientific process, undertook the challenge to find the answers. Once evidence is discovered, it is left to nurses at the bedside then to implement these changes. These changes that I listed previously make it seem like it would make our job harder, and in some situations it will require more patience and more diligence. That's not always the case though. Sometimes it makes our jobs easier. One example I came upon was not icing the cardiac output solution. This saved nursing time, but it took almost a decade before it became common practice. Currently, it is estimated that 30 to 40% of patients do not receive care consistent with the current scientific evidence. With more public access to health information, I expect to see patients advocating more for evidence-based care. This trend in nursing will have a great impact on our future in nursing. Evidence-based practice is the foundation of many other trends, because evidence supports having nurses with higher education, for example. And this trend of evidence-based practice directly impacts me in my future as a nurse. It will require me to stay up to date. It requires that I have flexibility in my practice, and it will require that I let go of my ego and my time so that I can implement the best care practices for my patients. This trend in nursing, implementing evidence-based care, has great outcomes for our patients and the larger populations. As nurses, we will be on the front lines of implementing evidence-based care.